Hi, this is Dr. Matt Rasmussen at Periodontics and Implant Dentistry of Tallahassee. We've been getting lots of questions about healthy gums and options to make sure that we have healthy gums. So today we're going to spend some time going through some of the most common questions that we received here at the office. The reason why healthy gums are so important is because the gums and the surrounding bone around the teeth are one of the protective structures around your dentition. So we want to keep our teeth and mouth healthy. The surrounding structures have to be there in a very similar way that the foundation has to be set correctly for a home. Many times it's very difficult to see if your gums are actually healthy or unhealthy. Some signs or symptoms that you'll notice that can cause issues would be any kind of bleeding of the gums, redness or puffiness of the gums, or if it hurts when you brush and floss. Many other signs and symptoms only can be seen by a doctor with x-rays and in-office treatments. Most problems associated with unhealthy gums typically relate to bacteria that is in the mouth. The bacteria stays on the side of the tooth and continues to attack the body and cause additional issues over time. Unhealthy gums can be fixed or managed with correct treatments in the office. The process of a deep cleaning is different than a regular cleaning. The reason why is because there's gum issues that are below the surface far enough that it's deeper than what we can typically get to with our normal brush and floss. In a deep cleaning, the patient's typically given some type of numbing so that the patient's comfortable in the chair throughout the entire process, and we use specific tools to get farther below the gum tissue. The number of sittings required for the actual dental cleaning procedure depends on how much work is being done. Many times in a deep cleaning, the procedure can last up to 3 to 4 hours in total. This is more time than most patients want to sit in the chair at one visit, or honestly the hygienist wants to be working in terms of just how they're feeling. So our goal is to make sure the patient's comfortable the whole time while they're in the office, so we typically break that up into 2 different sittings. One of the main goals that we have with a deep dental cleaning is to make sure that the patient is comfortable throughout the process. Unfortunately, in the past, many people have had not great experiences with deep cleanings because the patients were not made comfortable in the chair. One of the things we do to make sure the patient's always comfortable is if there's a potential for discomfort in the chair, is we'll make sure that the patient is numbed up so that, again, the procedure goes without any major. The most important steps after we do a deep dental cleaning is to make sure the patient has the ability to brush and floss correctly twice a day. Again, there's a technique-specific aspect to this, so many times we actually cover this at the time of the deep cleaning visit. And the most important time of day to make sure that the correct technique is used is at night before you go to sleep. Gum grafting is a procedure where we take tissue. This tissue can either be from the roof of the mouth or can be used from different types of donor tissue. The goal of this procedure is to thicken the quality of gum tissue and to cover the root in certain scenarios as well. This is typically needed if the gum process of recession, which is the gum coming away off of the side of the tooth, has gotten beyond the point of it being more than a 50-50 chance of it continuing to progress. I hope I've been able to answer many of your questions regarding healthy gums and potential treatment options. If you're ready to schedule a visit, please feel free to give us a call at 850-692-9200.